My name is Jennifer Rashad. I am very excited to start this program. Most people call me Jenny, and this is Lieutenant Dan. We call him LT. He's our family kitty cat, or one of them. So I will be using him to show you all the directional planes and everything. We're going to start with the sagittal plane. So that is the plane that is going down this way, cranial and caudal, cranial to caudal. It does not necessarily need to have equal left and right sides. Medial is the same direction, we're going down that way. Medial does put it into equal left and right sides, also known as mid-sagittal plane. Transverse is when we are essentially cutting him in half here. I know, sweetheart. And then we also, the dorsal plane is going this way with the dorsal and the ventral. I really liked it in the textbook and the video where they explained it as the pet is standing in water, and that is the dorsal plane, moving up and down. It doesn't necessarily need to be equal sides. Then we have right and left, making sure to note that we are always talking about the patient's left and right side. So we have here LT's left and right sides there. Cranial and caudal. Cranial is going to go up towards the head. Caudal is going down towards the tail. When we are talking about the head, we use the term rostral rather than cranial. It does get a little bit confusing when you're using cranial around the cranium. So rostral is towards the nose, and then caudal is down towards the tail there. Dorsal and ventral. So dorsal is this side, the back. Ventral is talking about this towards the belly surface. Dorsal can also be used in the limbs. That would be talking about the front surfaces of those limbs. Then we have medial and lateral. So when we're talking about the medial line, we're talking about medial will be anything going towards that medial line. Lateral is going outwards. Easiest to describe it as we're talking about the lateral surface of his leg, and then the medial surface is the inside. Proximal and distal. So proximal is going to be the going upwards towards the joint. I know. And then distal is going away. He's just unhappy, so I'm going to grab one of my other kitties here for a second. I know. This is Taco. Okay, Taco, we're just gonna finish up with you here. So proximal and distal, yeah, proximal is going upwards towards the closest to the body. Distal is the furthest point away. Palmar and plantar. So palmar is going to be the back surface. So this part of the paw, that's palmar, and then the back part, this is the plantar. And then when we are talking about joint movements, we're talking about flexion versus extension. So flexion is when we decrease that angle. So we're flexing. Flexion is here. I know. Extension is when we are increasing that angle. So we are currently extending his extension versus flexion. And then we have abduction versus adduction. So abduction is going to be when we move it away. Adduction is when we're moving it in. Adduction, abduction, abduction. Recumbency positions, so dorsal is when they are on their back. So I'll see if he is cooperative, but we will put, so he is in his, I know, dorsal recumbency. And then when they are on, we'll put his feet under and his legs. So this is sternal recumbency. Just because I do currently have him in this position, we'll also talk about oblique. Oblique is when you are using partly in one recumbency and partly in the other. So he is in his dorsal, lateral, oblique recumbency because he is in sternal, but also in that lateral there. This is very helpful in x-rays when we are trying to make sure that certain internal organs are not overlapping. And then lateral is when they are on their side. Usually you will use the terms left or right to explain which side they are in lateral. Currently he is on his left side. And then so for regional terms, this is actually kind of helpful. He wants to stay on this side. We have you can come a little bit closer. We have his hock here, right there, that joint. The tail head is where the tail meets that body there. The muzzle is the most rostral part, so right here, including his nose. And then the stifle is his knee. So that is right, I know, I'm sorry, right here. Sorry, it's hard to see with his fur, but it is right there, and he doesn't love me touching it right now, so I don't want to push him too hard. And that completes the video portion of my assignment. Thank you.